Hello, and welcome to the University of Tennessee Orthopedic Institute. My name is Kiki McKissick, and I'm the Orthopedic Coordinator here at UT Medical Center. And today, we will discuss your total joint replacement. As your healthcare team, we understand that surgery can be a stressful experience. We want to address your concerns by providing accurate information and educating you and your loved one about your total joint journey. So total hip and total knee replacement. Reason for a total joint replacement. There are a number of reasons why someone may need joint replacement surgery, but pain is usually the number one reason. Pain and other symptoms can interfere with daily living activities and affect your quality of life. Our class goals. Our goal is to provide outstanding quality care and improve the quality of your life through increased mobility and independence. The goals for the class are to help you prepare for your surgery, help you understand what to expect during your hospital visit, and to help plan your recovery and to ease your anxiety. Okay, let's talk about getting ready for surgery. There are a number of ways you can prepare your home for your return after surgery. Plan to have help at home for at least the first few days after surgery. Have a family or friend that can assist you with meals, bathing, dressing, and to take you to your follow-up appointments, and also for your outpatient therapy appointments. Consider arranging furniture so you can move easily through the house. Have clear and lit pathways wide enough to use a walker. Bathroom tips. Prevent slips and falls by installing railings and non-slip surfaces. Check existing grab bars for strength and stability, and repair if needed. You and your therapist may discuss ways to raise the height of your toilet seat. Make bathing easier by using a shower hose, liquid soap, a long-handled sponge, a bath bench or shower chair. Watch out for hazards such as wet floors. Draw off in the shower to prevent bringing water out onto the floor. Stock up on toiletries and other items that you may need during recovery. Medical equipment. The items on the screen can be helpful after total joint replacement. The items can be found at stores like Walmart, CVS, Walgreens, and Amazon. You may also check with retail shops, churches, or people you know to get a free walker. Typically, insurance does not pay for these items, but you can call your insurance carrier to ask. If they do cover the item, your surgeon can write a prescription for you. Pre-op exercises are found in your Joint Replacement Guidebook. Strengthening your muscles before your joint replacement is an essential part of preparing your body for your surgery and the recovery process. When your muscles are stronger, you will be able to recover more quickly. Leg exercises will help your non-surgical leg and also help support your surgical leg during recovery. Arm exercises will help build strength and help you use a walker. If any of the exercises aggravate your condition or any other injury, you may discontinue that exercise and continue to the next. Exercises should be performed 3 times a day, starting with 10 repetitions each and gradually working up to 20 repetitions each. Let's discuss how to access your Joint Replacement Guidebook. If you are using an iPhone running on iOS 11 or later, simply open your camera app and point it at the code. Once your camera recognizes the QR code, a notification will pop up with features to a link. Tap on the link and your phone will direct you to the proper website. If you're an Android user whose operating system is Android 9 or later, it's the same process. Just open your camera and point it at the QR code. Make sure you hold your phone steady so your camera can recognize it. Once it does, a notification will show up and the link to your correct website will be there. As you continue to get ready for surgery, keep in mind that you will not be allowed to drive until cleared by your orthopedic surgeon and when you're no longer taking pain medications. Take a look at your medicine bottles and get refills before your surgery. Consider preparing and freezing or purchase small portion meals for times that you may be alone. Stock up on staples that can be frozen for later use, such as bread, vegetables, and fruit. Unless otherwise directed by a doctor, try to drink at least 8 8-ounce cups of water per day. Medical clearance. Pre-anesthesia testing is a requirement before surgery. It is a medical clearance process provided by UT Medical Center to assess patients before they undergo anesthesia for surgery. So, for your PAT or pre-anesthesia testing appointment, bring insurance cards, photo ID, and a complete list of all medications that you take, including vitamins and minerals. During this appointment, you will meet with a nurse who will go over your health history. You will also have blood drawn and an EKG. You will be told what medications to stop taking before surgery and when to stop taking them. You will not meet with your anesthesiologist during this appointment, but one will review your health records. If there are any concerns, you will be contacted and referred to a specialist for additional medical clearance if needed. If there are any changes in your health after your PAT appointment and before your surgery, please contact your orthopedic surgeon. Dental checkup. You may ask, what does my teeth have to do with my total joint? Well, bacteria can easily enter your bloodstream through your mouth during a dental procedure and cause widespread infection. To minimize these problems, schedule a dental checkup in the months leading up to your surgery, if you haven't had one already. Continue to brush and floss your teeth regularly. After surgery, remember to inform your dentist of your new total joint. Preventing infection. Studies show that cleansing with CHG soap reduces the number of bacteria on your skin that could lead to surgical site infections. Using a CHG soap is one of the ways that we prevent surgical site infection. We also prevent surgical site infection by using an alcohol-containing antiseptic agent for preoperative skin preparation. We also give IV antibiotics before, during, and after your surgery. And you will also receive a nasal antiseptic swab in the preoperative area. How to use the CHG soap. Wash and rinse your hair using your normal shampoo. Make sure you completely rinse the shampoo from your hair and body. Completely wash your body, surgery leg, your growing area with regular soap and rinse off. Be sure to clean under all skin folds. Step away from the flowing water. Apply the CHG soap to a wet washcloth or sponge and gently wash your entire body from the neck down. Avoid your eyes and your private area. Gently scrub the soap on the entire surgery leg for an extra 3 minutes. Avoid scrubbing your skin too hard. Rinse the CHG soap off your body completely with warm water. Dry off and apply clean, dry clothes. Continue infection prevention. Staph aureus is a bacteria that can cause skin infections and potentially infections of the bloodstream, bones, and joints. This bacteria is commonly known as MRSA. 25 to 30% of people carry the bacteria in their nose or on their skin. This bacteria can remain silent and never cause infections, but patients who are carriers of Staph aureus are at a higher risk of developing a surgical site infection. To reduce the risk of infection, we provide a nasal swab to every patient on the day of surgery in the pre-op area. This swab is an antiseptic that will decolonize bacteria and decrease your chance of an infection in your new joint. Preventing infection at home. Remove clutter and clean your home before surgery. Place clean linen on your bed before coming to the hospital. Wash your hands before touching any area around your surgical site. No pets near your surgical bandage and no pets in your bed during recovery. I know we like to think our little pets are clean, but their little paws and booties can carry germs that we just don't want near your surgical site. And always keep your surgical bandage clean and dry. The do not list. Stop taking NSAIDs, for example, ibuprofen, Advil, Motrin, Aleve, aspirin products, blood thinners, and arthritis medicine 1 week before your surgery. Do not shave your legs 7 days before surgery. It's okay to shave your face and your underarms using a new razor. Do not wear lotions, powders, or deodorant the day of surgery. Do not wear contact lenses, makeup, lipstick, or nail polish on the day of surgery. Leave jewelry, credit cards, and large sums of money at home. And do not bring any medications with you to the hospital. Countdown to surgery day. 2 days before your surgery, shower using the CHG soap. Pack for your hospital visit. Think carry-on versus checked baggage. Less is best, don't overpack. The day before surgery, shower again using a CHG soap. Do not eat or drink anything after midnight. That includes food, candies, gum, cigarettes, chewing tobacco, or coffee. On the day of surgery, shower using a CHG soap before coming to the hospital. Only small sips of water if you have morning medications that you are instructed to take. What should you wear to the hospital? Well, most patients are here for a short period of time. Consider oversized or loose-fitting clothing, shoes with a closed heel, pants or shorts with an elastic waist. If you plan to stay overnight in the hospital, bring your CPAP machine to use for bedtime. If you use a CPAP machine at bedtime, keep in mind you will be required to sign a form stating that it's safe to use your CPAP machine while you're inside the hospital. On the day of surgery, if your surgery is at UT Medical Center, you will park in parking garage H. Go through the Fountain Circle main entrance to the main registration admitting office that is located on the first floor of the hospital. You will be registered for surgery, go over forms, and receive ID bracelets. You will be directed to the surgery waiting room. Your family can go with you to the surgery waiting room area. If you're having surgery at the University Orthopedic Surgery Center, park in the upper parking lot designated for patient parking. Enter through the front door and go straight ahead to main registration. Please check in at the front desk. Once you're in the surgery waiting area, a nurse will come for you and take you back to prepare you for surgery. Usually, your family member is not allowed back in the pre-op area. It will be 5 to 7 hours before you see your family again. In the pre-op area, an IV will be placed in your arm for fluids and medications. You will receive the first dose of IV antibiotics. You will meet your anesthesiologist to discuss your anesthesia options and begin the anesthesia process. Your surgeon or his assistant will see you before surgery and will mark the location and body part where the surgery will be performed. You will also receive the nasal antiseptic swab in this area. After you're prepared for surgery, your surgical nurse will take you from the pre-op area to the operating room for surgery. Your surgery will take between 1.5 to 2.5 hours. After surgery, your nurse in the operating room will update your family with a phone call. After your surgery, you will wake up in the recovery room. Most patients are in recovery for 2 to 3 hours. If you are going home same day of surgery, after the recovery room, you will go to phase 3 recovery. In phase 3 recovery, you will work with physical therapy, and your nurse will go over discharge instructions and medications with you and your loved one. Prescriptions are usually sent to the outpatient pharmacy within the hospital, and you can pick your prescriptions up before going home. If you're having your surgery at the ambulatory surgery center, please make sure that your surgeon has your preferred pharmacy on file, and they will send your prescriptions to your local pharmacy electronically. Safety and fall prevention in the hospital. Our focus is to keep you safe by preventing falls. Remember, the hospital is not your familiar environment. You may be connected to cords, pumps, or other equipment. Your nurse will evaluate and monitor your risk for a fall. If you need to get up for any reason, use your call button for your nurse and wait for a care team member to help you get out of bed or out of the chair. Do not get up alone and do not rely on family or friends for assistance. Ice therapy. Ice therapy is used to help control pain and swelling, and you are encouraged to use ice therapy frequently after surgery to minimize post-op pain and swelling. Incentive spirometer. An incentive spirometer is a small handheld device that helps you take deep breaths. This helps to expand your lungs more fully, preventing respiratory complications after surgery. Your nurse will teach you how to use the incentive spirometer. It is very important that you use your incentive spirometer at least 10 times every hour while you are awake. We recommend you use it more often if you have a low-grade temperature. You will also be encouraged to cough and breathe deeply. Be sure to take your incentive spirometer home with you and continue to use it for 2 weeks after surgery. Ambulating with a walker. You will begin walking soon after surgery. You will learn how to walk to the bathroom, in the hallway, and climb stairs with your walker. If you need a walker and you are discharging home, you will get a walker from the medical center. If you need a walker and you are going to a skilled nursing facility or to rehab, you will get a walker from the facility. If you're having surgery at the surgery center, you will need to let your surgeon know that you will need a walker for home. If you have a walker at home, please bring it with you and leave it in the car. Pain management. Controlling your pain is very important to us. You will be asked to score or rate your pain on a scale of 0 to 10. 10 is the worst pain and 0 is no pain. By using the pain scale, we will be able to monitor your pain level. So remember, you will have some pain after surgery. Everyone's pain is different. Motion is lotion. Pain is a part of the recovery process. Minimizing the risk of constipation after surgery. After surgery, constipation is a common problem. Pain medication, decreased activity, and changes in your diet all interfere with your normal bowel pattern. If you are experiencing problems with constipation, you may take over-the-counter laxatives or stool softeners, such as milk of magnesia, Docalax, or Colace. Taking less pain medication can also lower your chances of constipation. Minimizing the risk of blood clots. A deep vein thrombosis, or DVT, is a blood clot that can form in the leg vein after total joint replacement. A piece of the clot can break off, travel through the bloodstream to the lung, and could cause death. You will be given a blood thinner medication to avoid blood clots in your legs and lungs. The length of time that you will take the blood thinner will be determined by your orthopedic surgeon. Some risk factors for blood clots are inactivity, dehydration, hospitalization, trauma, clotting disorders with previous blood clots, smoking, and obesity. Symptoms of a DVT. Swelling may be present in the thigh, calf, or arm that does not go down with elevation, or it returns almost immediately when getting up. You may have a change in skin color. Extremities may be warm or cool to the touch. Pain and tenderness commonly in the calf, behind the knee, or the groin area. There are ways that you can prevent your risk of forming a blood clot. Get up and move around. Do ankle pumps. Drink plenty of water. Take blood thinner medication as prescribed by your surgeon. Avoid sitting or standing for long periods of time. Elevate your legs. Avoid crossing your legs. Control your weight. Wear support hose for at least 4 to 6 weeks after surgery if instructed by your surgeon. After surgery, you will have several tools to help you during recovery. Tools such as narcotics for pain control, nerve pain medication, maybe nausea medication, ice therapy, Tylenol, stool softeners, and laxatives. These are all your tools that will help you during your recovery process. Now let's talk about how to take your pain medication at home. Take medication as prescribed, but also as needed. For example, take every 6 hours as needed for pain. This means to take pain medicine when you start to hurt, but no sooner than the time on your prescription. Take for breakthrough pain. An example of breakthrough pain. Say you take a pain pill at 8 a.m. and you can't take another until 2 p.m. and you start to hurt during that time. This is called breakthrough pain. Ways to manage breakthrough pain: ice therapy, Tylenol, and some doctors will order other medications to help with breakthrough pain. To help manage your pain at home, stay ahead of the pain. Take pain medication 20 to 30 minutes before physical therapy. Apply ice. You do not have to set an alarm during the night to take pain medication. If you're sleeping, then your pain is considered under control. Discharge from the hospital. Planning your discharge began in your surgeon's office before your surgery. We do this so we can provide the most comprehensive plan of care for you and your family. Sometimes there is a need to adjust your plan depending on your progress. You will leave the hospital when you are medically stable and meeting your therapy goals. You will be discharged to the Fountain Circle entrance where your family can meet you to take you home. Pain medication. The state of Tennessee has very strict laws that your surgeon must abide by when prescribing pain medication. There are restrictions on how much pain medication your surgeon can prescribe for you. These restrictions are determined by the state of Tennessee and not your orthopedic surgeon. Please discuss with your surgeon if you have any questions regarding your prescriptions. For your convenience, the medical center has an outpatient pharmacy that can fill your medications for you before you leave. Please let your nurse know if you'd like to have your medications filled here at the medical center. Who to call? Call your nurse navigator for questions about preparing for your surgery. Call your orthopedic surgeon's office directly for appointment scheduling and rescheduling, surgery scheduling or cancellation, questions about PAT, prehab, or physical therapy. If you need prescription refills, you will also call your surgeon's office directly. Call when you start to run low on medicine. It can take up to 48 hours for prescriptions to be refilled. If you have questions about your insurance, also call your orthopedic surgeon's office. The phone number is 865-546-2663. And lastly, thank you. Thank you for choosing UT Medical Center Orthopedic Institute to be with you on your joint replacement journey.